you're a hiker who gets significant knee pain on those steep downhills, either just above or below the knee, I'm gonna walk you through a 3-step approach that's helped a ton of hikers eliminate that pain. So the important piece to remember here is that for hikers, it's either gonna be the quad or the patellar tendon, and the reason why is because we're continuously loading that quad and all those tissues up for an extended period of time on those downhills. So we need to stop looking at this as the pain is here or here and think about it as a continuous chain of tissue that we want to work on. So typically we're not going to actually get pain in the quad because it has a bigger ability to adapt because it's that muscle, dense muscle tissue, good blood flow. Whereas the tendinous stuff around the knee, less blood flow, much denser tissue, there's less movement through that tissue. So that's where the pain shows up for us. So what we need to do is simultaneously slacken this quad off and build up the strength and load tolerance to all of these tissues so that we can get back to hiking without pain. So let's head over to the gym and I'll show you guys that 3-step process. The principles are very simple with this. First, we want to smash it, then stretch it, then strengthen it. So what I mean by smash it is some kind of soft tissue work. Most regressed, easiest to do at home would be a foam roller, and then we can either go to a barbell or a kettlebell, and I think those two options are a lot better. I see people foam rolling a ton. They make the same mistakes, which I'm gonna correct for you in this video, but then they also we don't get enough pressure in there and we don't go slow enough and deep enough to make the change that we need. And that's why I'm gonna show you guys how to do that with a barbell and a kettlebell. Then we're going to get into stretching it, and again, I see this over and over. The choice of stretch and the time that you're stretching it tends to be the problem. People are trying to do the right things, but just not doing them right. So I'm gonna show you exactly how we wanna stretch out the front of this leg. And then finally, we're gonna get into some strength work that's gonna be very specific to hikers. And I think this piece is one of the most valuable pieces. So make sure you stick around to the end where I show you some variations there that you can clearly see how it applies to hiking down hills. So if you're somebody that does not go to a gym and just has a couple things at home, what we want to do is use the foam roller, but use it a little different than what we typically see. So what I see most often is people grab their foam roller, they throw both legs on there, and they just roll back and forward like this pretty quick and say, hey, I'm rolling my quads out. That's not going to be effective for anything beyond just getting a little bit of blood flow maybe into the quads. Not super helpful to us. What we want to do is take that foam roller, if that's all we have access to, and what we're gonna do is get down on it, start high, get just one leg onto it, the other leg's gonna be off to the side. This just allows us to get more pressure, and then we're gonna spend 2 minutes very slowly and very deeply trying to roll this out. So putting lots of pressure into there. And once we come across those most tender spots, that's where I want you to hang out and let the foam roller do the work. So if there's a really tender spot, just hang on it for a minute. You can even take that knee and start to bend it a little bit and relax it. And that's gonna cause change in the length of that tissue that's under the foam roller. And then continue on down, moving very slowly. You notice how slow I'm doing this, and that's where you're gonna get way more bang for your buck. Instead of spending time rolling out and not really noticing change, you start going deep and slow and thinking about a big wave of pressure, you're gonna get a way better release. So you're gonna spend 2 minutes starting high up in the thigh there, all the way down just to above the knee. And you have 3 options here. So depending on where you feel the most discomfort, explore a little bit, but we can choose to either hit directly over the quad here, come a little medially here, or come a bit laterally here. If you're getting that IT band type pain, do not roll directly onto the IT band. You're better off focusing on the tissue around that. We'll cover that in a different video because it's a whole different beast. But what you want to do is shoot for lateral quad here versus IT band out here. So that's a foam roller if that's all you have access to, but I highly recommend you get either a heavy kettlebell or a barbell to get more bang for your buck for the time that you're putting in. So what I want you to do if you're going to get the barbell option out is I want you to be leaned up against something, whether that's a box or a wall, so that you can relax your body. The reason being is one of the main quad muscles that we want to work is your rectus femoris, which runs right down the middle, hence why we're getting that either quad or patellar tendon pain. That's really tight. It also acts as a hip flexor and a knee extender. So what we want to do is take the wall to take that portion out so we're not holding ourselves up so it can relax as much as possible. You're gonna take the big end of the barbell here and you're going to start, same idea, nice and high, and you're going to apply pressure down onto that barbell if you need and can handle that extra pressure. If not, just the weight of the barbell does the job for you, and you very slowly just roll down that quad and you'll feel the difference of this compared to using a foam roller. Now the key here is the level of pressure that you're doing. So you want fairly high level of discomfort, you do not want pain. Easiest way to differentiate that is if you start making some like grimacing faces, you can't carry on a conversation, or you're kind of like wincing, right? You're maybe holding your breath, you're feeling your body tense up. That's too much pressure and your nervous system is getting wound up and it's not gonna let that tissue go. So we wanna be right in that area of discomfort but not pain. If you're feeling like you're kind of on the edge, just hang out in that sore spot, let the barbell and the pressure of it do the work for you. Try and breathe and relax and calm your body as it's on that edge of pushing into the nervous system revving up and getting too uncomfortable. And what you'll notice through this is that it's not actually your entire quad that has kind of gummed up bad areas, but just specific little spots within it. So when you find them, come right up to them, stop and just hang out on it if you need to until that discomfort dissipates a little bit, and then keep going, or maybe adjust the pressure just a little bit. Quite often what you're gonna see if you're doing this properly, or see or feel, is little muscle fasciculation. So basically that means those little like jumps within that muscle, and that's perfect, that's great. That's what we wanna see in there. And you're gonna roll all the way down. This is one pass could take you a full minute. So I would rather you do less passes, but more meaningful passes than a whole bunch. And again, depending on exactly where you're feeling this, you can come a little more medial or lateral, which I'll show you in a second. But this is where my kneecap is, so I would roll all the way to just above it. So you kind of come off that main big bulky part of the quad and just go a little bit further until you're basically butting up against the kneecap, just to leave a tiny bit of space there. Do not roll over the kneecap itself. So if we wanted to hit this a bit more medially, all I would do is kind of shift my body a bit, and now I can get more of this side. But if it's that quad or patellar pain, you're primarily working on right down the middle of it. I'm just showing you guys a couple options in case you're having quad tightness throughout the whole thing. If you want to come a bit more laterally, key is take this leg, put it under so that that knee's supported and not just totally free here, right? Because if I take this barbell down, suddenly we're putting a lot of pressure on that joint. So just sneaking that leg under there gives it the support it needs, and you can hit this lateral edge. So now that we've covered off the smashing portion and getting into that soft tissue, now we want to put stretch on that quad. I'll show you guys a couple of different options depending on what kind of ranges of motion you can get into. So if you're really tight through that quad, my suggestion is just come to this lunge stretch here. What we want to think to cue this is we're going to tuck our pelvis underneath, a little bit of a posterior pelvic rotation. So tucking that tail underneath as opposed to being here. We tuck it underneath. We squeeze that glute just a little bit, and a little translation forward should get you feeling a stretch into that quad. Now what we want to do is hang out in this for 2 minutes and think, contract hard through that glute, relax it a little bit, contract hard through that glute, relax it a little bit for a full 2 minutes. If that's giving you a lot of stretch, great. If not, we're going to progress to our couch stretch next. So what we're going to do, we're going to get our leg up on a bench like this, or we can use a wall, or like the name suggests, you can also do this on a couch. So from here, if you're only able to get into this position because you're tight enough, that's okay. If you can get to here, great. If you want to use a dowel for balance, that's totally fine. And ideally what we do is we get to where we can sit in this nice high position. Same idea, contract through that glute and relax it. So you can see that little bit of movement, and you'll definitely feel it in the quad as you contract that glute. Then relax it a bit, contract, doing that for a full 2 minutes. This is kind of where we want to get to. The next progression, and the best one if you can get into it, is to add a band to this, which I'll show you in just a second. So what you're going to do for the banded variation is you're going to take a band, make sure you have something heavy to anchor it with, ideally into a wall or a squat rack, or get some good heavy weights. And then you're doing that exact same couch stretch, but now you have this band pulling forward on that as you're into that same position. Again, you're still shooting for 2 minutes. contracting and relaxing through the quad as we go and getting nice and tall. What we don't want to see is a big arch through the back to get up to it. So if we're sitting here like this, we're not really hitting what we want. We still want to be tucked under with that pelvis, squeezing through the glute, relaxing through the glute for that full 2 minutes. And that's going to give your quad a way better stretch than some of the traditional quad stretches that we see. So now we've smashed it, we've stretched it. Now it's time to take it through a full range of motion and get some strength into that quad. Now I'm going to take you through 3 different exercises that are going to help strengthen the quad, and they all have their own purpose. So this first one, a little bit cumbersome to get into, but very valuable. Ideally done with a Swiss ball or exercise ball because it creates a little bit of instability for it, but we're going to do rectus femoris isometrics with this. Then we're going to get into an exercise where we're going to push through a very full range of motion that the quad usually doesn't see, which is going to put stretch on it and get us stronger in our weakest positions. Then finally finish off with that super valuable hiking specific loading of that quad and that knee with a downhill variation. So this first exercise obviously takes a little bit of finagling to get into. Once you're here, you get that ball up against the wall, and what I want you to do is just press into that and hold, and we're going to do an isometric there for 30 seconds. And you can see that movement, and you're just pushing into that for that full 30 seconds, hard as you can go there, and then come off of that. After you've done that, what we want to do is what we call a cyclist squat. So our squat stance is going to be relatively narrow. We're going to have about 4 to 6 inches between the legs, and that's going to just help us keep this very quad dominant. We want something that's going to lift our heels. If you have a slant board, great, that's probably your best option. If you don't, you can obviously find a way to modify to lift those heels up, and we're just dropping down. Think and drive those knees out over the feet until we get all the way to our hamstrings or sitting down onto our calves, and we come back out of that. We keep our torso nice and upright. If you want to use your arms as a guide, that is helpful. And the huge benefit that we're getting here is taking this through a huge range of motion that we usually don't get this deep. In our deepest ranges here, we work this VMO muscle a little bit more than when we're higher up. So that will help stabilize that knee as well. And then we'll come back out of that. I'll show you again from a side angle. And you can also play around with, if you have access to it, the amount of slant that you have there, which is obviously just going to let you get deeper into it because it takes the ankles out of it so that we are not limited by the range of motion our ankles are capable of allowing us to get into. So again, arms are out to use that as a guide. Stay nice and tall through the back, driving our knees out over our feet, dropping right down until our hamstrings are sitting on our calves there, and then come back out of that and keep that stance nice and narrow. And now we have options for this. We can either load this and stick within a rep range of about 10 to 12 reps, or what we can do, which I love for hikers, is as many reps as possible in 2 minutes. So that means you can either bang them out relatively quick and take little breaks as you need through that 2 minutes, or pace yourself and figure out what pace you need to go at to do 2 consistent minutes. It pumps a lot of blood into the quads and the knees, and I like it because it has that endurance component, which we see when we're hiking a lot. And now you guys, as promised, the best and most valuable exercise in this entire video is going to be this next one. I'm going to show you 2 variations. So it is the Patrick or the Poliquin step. We want to regress it to whatever level we're at. So our Patrick step, all we're doing is we're just stepping out. So if you have a lot of knee pain, you might just be doing small little steps like this. As you get better, that one can come out a bit further, or you can start to weight that. Once you can do about 2 to 3 sets of 20 like this, without any pain that day during the training session or the following day, then you want to move to the Poliquin, which is basically, we're just going to use a slant board again. And what we're thinking at first is that the heel of this foot is about where the toe of this foot is. And we're just stepping down into that. So if you can come to where there's something where you can just drop straight off, the most regressed version would be coming right to there. As you get better through this, what you can do is increase the reps and start bringing that foot a bit further out and driving further over those toes. And then eventually too, you can start to load this. Or what you can do as another progression is increase the slant there and drive that knee even further out underneath it until you eventually get to what it looks basically like a pistol squat for us. Once you're able to do that, just about guarantee you're not going to have that same quad or patellar pain because you're going to release a ton of the tension through here, build a lot of strength through that rectus femoris, and allow that knee to handle a lot more tension. So if you were a hiker that gets a ton of knee pain on those steep descents, start doing this 2 to 3 times a week, and you're going to notice that that pain on those downhills nearly disappears. And if you're a hiker who found this valuable and you want to see more videos specific to hiking and some of the injuries that we deal with, make sure you're subscribed so that you can catch the next video.